Welcome back. Immediate mental health care for kids is coming to Green Bay this fall. Children's Wisconsin will open a mental health walk-in clinic in partnership with this Bellin location on St. Joseph Street as soon as they have hired staff. Children's in Bellin, remember, are also partnering on this facility, a pediatric and adolescent center that's on Ashland Avenue. That's very close to opening. But the mental health clinic will be the third such facility in the state, all with financial support from Kohl's. The Milwaukee location opened 3 years ago, with a facility in Kenosha opening last year. Over 3,400 kids ages 5 to 18 have utilized these urgent services. And we welcome in Mandy Quinnell. She's a Children's Wisconsin Director of Acute Mental and Behavioral Health. Let's just start with the location itself. Why Green Bay, Mandy?
Well, we made a commitment to enhancing the mental and behavioral health services across the state. And when looking at the market data, working with our partners, especially strategically through, we know the Connected for Kids partnership, and especially with Bellin Health, we recognized that there was an opportunity to bring in this unique service into the Green Bay area. And after many discussions and analysis of our information, we landed on a wonderful location, especially in thanks to Bellin Health.
Mandy, you said it's a unique setup. So for those who obviously we're not familiar with it, so how does it work? Is this for first-time patients? Is this for patients who may have a mental health care provider but just can't get in to see them?
It's for any of those, and I'll just give a little background on how we developed this concept. Part of our strategy was to enhance access and timely access to mental and behavioral health care. And this really came down to what our families told us that they needed. They really wanted immediate access when they feel that they need it. And that doesn't always align when we offer it or when we think we're providing it. We don't turn away really anybody. And if there is an established patient, we will still take that patient in and we will work with them on what is needed right now, immediate coping strategies, immediate help. And then we really do our best to connect with that ongoing provider so that there's not a loss of continuity or there's not a loss of transparency with what that ongoing provider may be able to help with as well.
Mandy, these are for kids ages 5 to 18. I'm curious if a teenager, and we'll get to some of those statistics in just a second, but if a teenager just feels the need, they have a need for this, but maybe they don't want their parents involved. What happens in a case like that?
Yeah, the over age 14, we know that, we do want that consent from the child. We do actually prefer, a parent or guardian to consent also to that treatment. But we will, if a patient does present on their own, we will work with them to make sure that we, are appropriately providing care, but also making sure we're, connecting with the people in their life that they need to, be connected with.
And part of this too is directing them to continuing care and resources. You guys will be very actively involved in that. I want to get to the teenager portion of this. The Youth Risk Behavior Study by DPI, they do it every couple of years. The most recent survey said 59% of high schoolers in Wisconsin reported at least one mental health challenge in the last year, and a third feel sad or hopeless. That's up 10% in the last decade. These are numbers I know you're familiar with here. But nearly 19% are seriously considering suicide. Can the clinics be a form of crisis prevention? Are they a form of crisis prevention?
Yes, we do a screening at every appointment for suicide, and then we will actively work with that patient and family to assess the level of risk, assess, and do a safety plan. Do we do evidence-based treatments that will, help frame up what can be done ongoingly to help prevent that crisis from happening again? We would like to serve as an urgent step, before somebody might get to that point, so that we can really identify the risk and try to help get resources in place and get a safety plan and get the care initiated sooner so that we could potentially prevent that from happening. So that's really one of the cornerstones of this type of clinic.
I want to go back to what you said earlier about why Green Bay, and you looked at data and things like that. And you obviously did that before you opened the other 2 clinics. Have you learned something from the operation of those 2 clinics that maybe you weren't expecting?
That's a great question. I think, we thought perhaps more patients would come in that maybe then we would need to divert to an emergency room. And so we had to study what was actually happening with our families because we wanted to be the right level of care at the right time, at the right place. And the last thing we wanted to do was confuse families about, what we provide and what we don't provide. And I'm proud to report that we have a very, very small volume of kids who need to elevate their care to a higher level from our clinic. So our goal is really to, catch those issues and then help get them connected and get coping strategies in place. We're also proud to report that we've had, 0 suicide deaths that have occurred with any patients, following our visits.
Okay.
So we continue to, we're fairly new. We're 3 years in.
Right.
So we are continuing to study, what's happening with the kids after they visit us. So we study, are they going to a higher level of care? Are they connecting to ongoing treatment? Are they having revisits? What can we do about making sure we don't turn any patient away for a revisit because we want them to feel welcome. But then we want to kind of get to the root of the matter of how, what's causing the revisit? What can we do to make sure that we can get connected to the right resource so that they can, have that ongoing care.
Well, this will be an important resource here in Northeast Wisconsin when it's up and running. Mandy, thanks so much for the time. We appreciate it.
Yeah, thanks for having me, and we're excited to work with everyone in the Green Bay area.